next presentation will be done as a discussion. The goals are to better understand how invisible illnesses and episodic disabilities are experienced through the lens of intersectionality. Also, as a way to better understand unconscious bias and discrimination in long COVID and other health conditions within healthcare sessions. Again, this presentation will be done as a discussion, as our guests are on screen now. Welcome.
Thanks for having us.
Thank you.
Thank you for having us.
Thank you.
So, Jimmy, do I just take it away now?
This is 100% your show. You are in charge.
Yay! I am so honored and completely honored and excited to chair this amazing session with these amazing human beings who have done so much for our community and for the lens that we all look at our own identities and abilities. And here I am just excited to chat about bias, the impact of disability, the recognition of long COVID and its juxtaposition with intersectionality and everything that all of us as a global community are going through. So before I shoot off the questions, I would love for each of these wonderful individuals to briefly introduce themselves and let us know who they are.
I can start. My name is Chimere Smith. I'm from Baltimore, Maryland, in the United States. I was a teacher for 5 years in Baltimore City until March of 2020 when I became ill, very ill with long COVID and COVID. I experienced a lot of medical racism and also sexism while I tried over 12 times to be treated for my symptoms, which were I had over 50 symptoms. Since July of 2020, I thought it was important via the media, print, social media, televised media, and whatever media I could get my hands on, as well as being politically associated with the politicians in this city. I thought it was important that people hear my story and know my plight. And also I have begun to educate Black families in more urban communities in the United States about the effects and the trauma of becoming sick with long COVID and becoming disabled, because I am a long COVID patient who is now disabled due to long COVID. Thank you.
Thank you, Chimere.
I'll go next, I suppose. My name is Dr. Marcia she, they. I'm sitting on Seminole Tribe land in Florida. I have Sjogren's syndrome, hypermobility EDS, and lots of other fun things. I do not have long COVID, but welcome to the community, everyone. You'll find out we have a lot in common. I do share a lot of movement and accessible ideas for movement on Move with Marcia. I'm on YouTube, TikTok, all that good stuff. And I'm also the co-host of the podcast, Disabled Girls Who Lift. So if anyone wants to listen or hang out with us, feel free to email me after this. I'll just stop there.
Thank you, Dr. Marcia.
I'll go next. I am Ashanti Daniel. I'm a disabled registered nurse and a person with myalgic encephalomyelitis, also known as ME or ME/CFS. I have been sick now for 6 years. My onset was post-viral, but of course, 6 years ago, there was no COVID. So I don't have long COVID, but I do have post-viral ME. I was actually officially diagnosed with ME on International ME Awareness Day a little over 5 years ago. So it took me about 9 months to get diagnosed. And being diagnosed on the awareness day was kind of like, okay, advocacy, here I come. Like, it was just a space that I felt was something I needed to be in, and especially a space to help other Black women and brown women too, and men navigate the healthcare system, because now here I was on the other side. I had been on the side of a healthcare professional. Now I'm on the other side as a patient. So anyway, I'm really happy to be here and be on this panel with these lovely women. And yes, I look forward to our discussion.
Thank you, Ashanti. Who's next?
Okay, I'll go next. Yeah, first of all, I want to apologize. I don't know why my camera is this dim, but it's a bit too late to adjust. So, yeah, thank you. So my name is Nnenna Chigbo. I'm a physiotherapist, a clinician, and I also do research. I've published a bit. I'm the president of the Nigeria Society of Physiotherapy. And in the last 2 years, I was the chairman of the COVID task force. So I had a bit of interaction with people living with COVID. I've had back pain for a while now. So it's not visible. So it's an invisible disability. Yeah, so I've had to readjust the way I do things. And I have a bit to say about barriers for invisible disabilities. Yeah.
Thank you, Nnenna.
I guess that's me next. Monique. My name is Tracey Thompson, and I'm in Toronto, Canada. I have long COVID. I have ME, post-viral induced by long COVID. I am disabled, and I have been, I guess, again, an early adopter of getting the word out and trying to advocate both, in sort of in front of the camera and behind the scenes. And I'm about to start a new project, hopefully, to sort of gather together both Black and Indigenous people across Canada and talk about our experience with long COVID in the medical system.
Thank you, Tracey. And last and certainly not least, Monique.
Hello, everyone. My name is Monique Jackson. I'm based in London, United Kingdom. I fell ill in March 2020 from a suspected infection of COVID-19. I couldn't get access to testing at the time. I then had ongoing long COVID symptoms. Fortunately, my condition substantially improved after receiving the Pfizer vaccine. However, I do still have changes that have happened in my body, and I'm managing my condition. I am an artist. My career changed quite dramatically from COVID to be remote. I was behind the scenes in galleries, whereas now I am an illustrator, and I sort of documented my experience with long COVID on Instagram called Still Ill Corona Diary. And I'm now a trustee at the charity Long COVID Support, and I'm also involved with patient-led research also. Thank you.
And I forgot to briefly introduce myself. My name is Dr. Uchenna Ussai. I am a pelvic health physical therapist based in Austin, Texas. I just completed my tenure at the University of Texas Dell Medical School in their Department of Women's Health, where I focused my clinical and research and teaching efforts on the impact of discrimination and oppression on Indigenous and Black women, BIPOC individuals, and individuals in the LGBTQIA+ communities. So thank you so much for allowing me to chair this. And I'm excited to talk with you amazing humans. So the first thing I want to do that we often kind of get wrong here in the healthcare world is when we're trying to figure out a solution, we don't actually clearly define the problem. And so my first question to you all is, what does disability mean to you? In the lens and in the identities that you inhabit?
I'm going to jump in if that's okay. Yes. For me, I think it's a couple of different things. It's not, obviously, it's more than a couple of different things, but there's the personal, there's the things that are, physical, cognitive, emotional, sort of things that are outside of the norm, that, affect your day to day, your relationships, your access and your autonomy. And then there's the larger picture, which is the political sort of scope of disability, which is, a category that's used to exclude people from public life. So initially, when we think about things sort of in a bigger picture, if you think about it as, say, sort of, in the realm of like intellectual capacity, where people that had been used. So I'm going to go right off here. Had been used, previously to sort of as an excuse to, to take lands, to enslave people, to keep people from participating in political life. So it's like your diminished capacity. Either whether we decide it's a physical diminished capacity or intellectual diminished capacity makes you not a viable candidate for participating in public life, in maintaining your autonomy of your, you as an individual and your people as a whole. So it's a really large category where, we sort of think of it of like, okay, somebody has a particular physical illness or a particular mental illness. And then if that person is no longer has access just because but the world is built specifically so that people don't have access when they fall outside of what's considered to be the norm. And the norm is movable depending on, the state of the world. So that's my big talk. Does that make sense?
It makes perfect sense. It makes perfect sense because it's coming from your lens. But I think a lot of us can identify very much with the themes and trends that you're speaking of. Yeah. Who wants to chime in?
I think I'm going to, there was one word that I heard Tracey use. This is Chimere. I'm from Baltimore, that she used twice because I listened. I'm listening for it. Excuse me in advance because with long COVID, I have developed a even deeper stutter and it's worse than my stutter. And I do have COVID brain. So there are times where I cannot find the right word. And as a former English teacher, you can imagine that frustrates the hell out of me. But for me, disability as a disabled woman now means restricted access. So many restrictions now that I am disabled. Things I had not considered. I wrote once in an article about my experience testifying in front of Congress. I talked about the fact that being a Black woman in America and having a job or career that everybody approved of. Everybody loved the fact that I was a teacher, right? And, with becoming a teacher, I gained, health benefits, that little blue and white Care First Blue Cross Blue Shield card that represented the fact that I had insurance, and the fact that I was making a decent salary gave me what I believed was the best entryway into unlimited access to everything, to healthcare, to political access, to to governmental access, and, being accepted and validated because of what I did. I was taught as a young girl to keep my head down as a Black woman and work, get your benefits, get your money, and go home, right? What I've learned as a disabled woman is that my disability creates a standard of restriction everywhere. And so now what I've encompassed as a disabled woman is that I am always looking in the face of people and walking through the doors of restricted access. It's like, you ever seen those movies where there's a robbery happening and there's a dark room and there's red lasers everywhere, right? To represent the fact that if you don't bypass those lasers, you're going to get caught. As a disabled woman, that's the restricted access I face all the time, every day, from my friends, my peers, my family members, strangers, doctors, other medical professionals who claim to want to care for me and support me. However, on the flip side of that restricted access, as a Black woman who is now poor because of my disability, because I spent all of my savings, I am a retired disabled teacher. There seems to be no limit to access to the expounded racism and sexism and ableism and ageist discrimination that I face, right? So I'm restricted and yet I'm unrestricted. And so the pile on came on when I started to express as a Black woman how medical professionals and other people restricted my ability to receive care, compassion, treatment, research, because I'm a Black woman. And so there's this dichotomy here between restriction and being unrestricted, but everywhere in every aspect of my life, I am restricted. I normally, and as I close, I normally would love to wear makeup and look cute for these kinds of panels, because that's just who I am before I got sick, and it's still me now. But after putting this new couch in my house and moving around my furniture. And I do a little pet sitting to make some money because I am poor. I don't have a lot of money, right? I said to myself, to hell with makeup today, because I don't have the energy or the capacity to do it today. And so there's even restriction, as Tracey said, in my personal life. So that's what disability means to me. It's restricted access. And yet, because of my color, my gender, and what I believe and who I am, it's unrestricted access.
Okay, can I just come in here and sort of like continue this flow? Yeah, so for me in Nigeria, and I think I'm going to speak for the African woman, it's almost as if you're not allowed to say you can't do this. Yes. I don't know whether this is a bit of gaslighting. You have this pain and you're told endure it, you know. You can't do this and people think, you're just lazy. So for us here, disability is more than just physical inability to do anything. You have to deal with the psychology of, being able to explain to people, I'm just tired. You hardly find women, Black women, mothers, take out time to rest, to get themselves together. It's almost as if you're being selfish. It's as if the society expects you to pour out your life for every other person, irrespective of your pain. Let's take, for example, you have menstrual pain. Nobody cares whether it's disabling. You're supposed to go through life with it, care for every other person. So that's why I'm like, I really get passionate when you talk about disability, because I like to talk from the aspect of the invisible disabilities that women experience every day, and nobody's talking about it. Nobody recognizes it. You know, I once had a patient. I'm an oncology physiotherapist, so I had a patient with breast cancer. That's the majority of my cases, and even before she could go in for surgery, she had to be convinced, because everything was about what will her children do if she's not there? What will every other person do? And she was just so fatigued, so worn out, but she was willing to keep stressing herself, to keep up the image of being a good mother. So I don't have the right word for it, but maybe at the end of this panel discussion, we could come up with an identification for that class of disability. It's more like mental. Everybody expects you to be fine. You can deal with it no matter how you're struggling. And the beautiful thing about the Black woman, we always pull through. We always pull through. You could be sick, you could feel pain, and you're still delivering, and everybody feels you're okay. Yeah. So disability, to me, is more than just not being able to physically do stuff, because at times you're forced to do those things, but you're doing it with pain, with too much stress, and feeling of nobody really cares for you. And somehow I say the women is also our fault. We should learn when to step back and say, I need a break. I need to sit down, catch my breath, and then continue.
I absolutely love that, Nnenna. And I just want to chime in because I am a mom. And so although I'm not in Africa, I'm in Southern California in the United States. I experienced that same thing. And in fact, I was just talking about this yesterday about how I put on this brave face, right? I'm a single mom. So it's just me. One of my children is an adult, so she's out on her own, but I do have a teenage child that's still in the home. And so there's so many days and so many times when I'm really, really struggling. But I put on this brave face to not feel weak, I guess, to not look weak, to not be failing as a mother, you know what I mean? Because there's this idea that you have to, be present, you have to be well, you have to be functional to be a quote unquote good mom, right? And I also feel that there's additional pressure on Black women who are single mothers of male children. My teenager is a boy. And so there's added pressure for me to, parent him in a way that yields, to him being ultimately successful in this life. And so it's heavy. And so a part of the disability experience for me is that not even really being able to outwardly express just how bad things are for me day in and day out because I have to put on this brave face, you know? And so also, like Chimere said, the restrictions, oh man, like I was living that because my daughter, who's the adult child that I have, was just in Europe this summer, and she was in Mykonos and she was in Santorini and all these wonderful places, which is awesome. But while she was there, she was sharing her experience and she was like, oh, you can never come to Santorini. It's not handicap accessible, blah, blah, blah. So things like that. Like, and I used to love to travel when I was healthy and fit and all of that. But now that I'm disabled, it's things like that that I have to think about because I do use a wheelchair if I need to walk more than a short distance. And so anyway, I just wanted to chime in on both what Chimere and Nnenna said, because both of those things really hit home for me. So thank you.
Definitely. This is Dr. Marcia here. Definitely agreeing with everyone. I think the biggest thing is, I mean, how you asked the question is, what does disability mean to you, right? But what does disability mean to the greater society? It means that, number one, you can't be cute. You can't be employed. You can't take care of anybody else, right? You must be incapable of joy or movement or achieving anything, right? And then, so when you become disabled and you become that person, you're like, well, I can do some of these things. So this is confusing. And then you start to think about more, because the literal definition of a disability is just having a physical, mental, or emotional issue that requires you to need accommodations to access your environment. Like, that's the literal definition. That could be anything. And we don't realize it's more than can't work, can't drive, can't this, wheelchair, right? It looks like, oh, we're going out to dinner. Where is it? Is it air conditioned? Is there a ramp there? How long are we going to be there? What time of day is it? Because, my IBS, I need a couple of hours. Okay, what are we doing after? What kind of food is there? What kind of plates are they using? Because, I'm allergic to this. That's what it looks like in practice. Is every moment of your life, you got to have questions. You got to have extra planning and extra thought just to engage with everyday normal things. So when you're dealing with that on top of, well, society says that I must look like this and I must do that, it's kind of hard to really conceptualize what disability means, because all you were used to was disabled equals bad. And it doesn't.
Yes, I'm loving this conversation. Monique.
Hi, sorry. I've just been listening to what everyone's saying and just nodding away because it's really resonates. I think for me, what does disability mean to me? Long COVID had, even though I had had migraines before, it was really the sort of experience that changed my perception of disability. I felt a need to refamiliarize myself with the term because it carried so much emotional weight. And I had these cliche, outdated ideas and internalized ableism about my recovery, and the fact that it hasn't been fixed. It's not been a sort of static thing, and it hasn't been visible. My pain couldn't be seen, and there weren't like biomarkers that came up. I sort of also wanted to mention about the legal term of disability in the UK, an illness that has substantial and long-term adverse effect on the person's ability to carry on normal day-to-day activities. And I know that, for instance, with long COVID, that the scale is 384,000 people have said that their daily activities have been limited a lot. And it goes back again to visibility and the need for people to emotionally connect with the word. I think that there is this reluctance because of different reasons to identify with it. And obviously there's a real sort of legal support that can come with accessing the support needed with disability, and there's a lot of shame and stigma around it. And I think of disability, I think of current and historic collective action movements that which are intersectional, that have seen oppression of people. I've been reading Ellen Clifford's book, The War on Disabled People, and she brought to my attention how the Black Panther Party and the Centre for Independent Living were like in solidarity in the 1970s with like bringing people's attention to the fact that students are segregated in living, and like clearly, you know, this is an ongoing issue about the barriers to needs. And so I just wanted to kind of make note of the past, because often there is sometimes a focus about things currently, but there is this tradition of people coming together. And I don't think the onus should be on individuals to educate themselves. We all should educate ourselves about disability, because it is a really broad term. Thank you.
Thank you. You know, one of the things that I was hearing from all of your powerful voices is the theme of not just the systemic oppression and the systemic perspective that people look at in terms of disability, but then, of course, we have the interpersonal, the community level component, but then the internalization of it that so many of us identify with. Right. And what's fascinating is that when you're looking at it in the context of race and disability, right, there is this similar track that I'm hearing about. I'm highly visible, yet completely invisible. And when I need to be visible, I'm completely, it's almost like you're chasing your own tail. And so what I would love to hear from you all in specific ways when we're thinking about, the difficulties in accessing care, right? Accessing care, receiving care, the quality of care. What role do you think your identities, your individual identities have in the quality of care that you receive, the outcomes in the treatment that you get, and then your ability to advocate for yourself?
I'd like to go first on this one if nobody's ready to rip. I will say that the one thing that I always think about when it comes to my medical care is that if I was not a physical therapist, if I was not somebody in the system, none of this stuff would have happened. I wouldn't have understood that doctors had no idea what they were talking about, that people were speaking to me as if I was unintelligent, that people were making assumptions about me just based on the color of my skin. I would not have understood those things. I would have looked at these doctors and been like, okay, thank you, sir, and gone home. So to me, that's the number one part that is so scary, is that if you have no idea how healthcare is supposed to work, that people are supposed to care, you're going to go into these spaces and be like, oh, well, I guess I'm wrong. I'll just go home now, but because I understand, number one, everybody knows their body. You don't need a degree for that to know something is up, right? And number two, I spend all my free time on PubMed. I'm in there like, oh, what does low vitamin D mean? Enter. What does this mean? Enter. What does this mean? Enter. Like, I'm ready, right? And these people are out here like, oh, well, you're young, you're fine. It's okay. Like, no, it's not. But if I didn't have that background, I don't think I would have had the gumption to look these people in the face and say, you're not giving me the care I need. This is not enough. And I will literally, when I have the energy and the spoons, write letters to people. This was inadequate. You need to do this better for your patients. And if I wasn't a provider, I don't see how a regular everyday person could go through this experience and get anything positive out of it. I don't see how. So
you're saying that your degree gave you the audacity.
Essentially.
That society spent so much time beating out of you.
Essentially.
Yeah.
Oh my goodness. Marcia, that's the second time you done preached to my soul, and it ain't even Sunday. Uchenna, am I pronouncing it right? Uchenna?
Uchenna, Ussai, whatever you want, my friend.
Okay, Ussai, I love Ussai. What you said about being seen and not seen, and what Marcia just said about if I had not had this, and also what I mentioned about what we are taught as women of color, Black women, from the time that we are old enough to understand the words work, job, status, career, money, is that is so true. And what I often feared really greatly in 2020 was, and I'm getting emotional as I think about it, because I remember sitting in Johns Hopkins at least 8 times from April of 2020 until July of 2020, when I just decided to just say to hell with it and protest going to the doctor. And like Marcia, what I did was I lost my vision in my left eye. Long COVID caused me to develop a deep cataract in my eye, so where I could not see. And doctors were telling me that the only problem I had was a dry eye, right? So in the dark, in the basement, because I was afraid of making anybody else sick in my house, with the door closed, the only sound is like the light hum of the TV. I thought to myself, I said, I have to write an email to as many people who will listen, even though I could only see out of my good right eye. And I said, the reason why I have to do this, even though I was as sick as I've never been so sick. I could not get out of bed. I could not swallow. I could not think clearly. My memory had been shattered. I had started to become delusional and have hallucinations that a group of people dressed in all Black was telling me to die. I said to myself, I have to write these emails and I have to challenge what is being said to me, because I am a teacher who teaches in a Title I school, and that's a lower income school, mostly Black and brown children. They and their parents, because these kids live with their grandmas, their aunties, their cousins. They are going to go to Johns Hopkins. They are not going to know exactly what to say like I do, because I am a wordsmith, right? And these doctors are going to look at them and tell them to go home like they were telling me, because they are not going to be able to articulate it, and it's not going to be their fault. So every time I wrote an email, every time I got the gall to speak up against how I was treated in these hospitals, I had a doctor, a male doctor, tell me that COVID could not cause neurological damage in July of 2020. Every time I got the confidence to speak up, I kept thinking to myself, what would happen if I did not have this English degree? What would happen if I did not have the wherewithal to be thinking of my students and their mothers and their families? What would have happened if I had just been quiet? And even in the midst of being so sick, so nauseous, so just disillusioned with the healthcare system, I thought to myself, something in what I'm saying will create some type of change for somebody, even if it was me, because I was definitely afraid that I was afraid I was going to die every day for like 8 months. I thought, oh, today is going to be the day you're going to die. And if I hadn't died by God's hands, I was ready to commit suicide, because long COVID does cause neurological issues that cause inflammation in the brain that affects mental health and affects, your brain. So, Marcia, you saying that just because there's so many of us, especially in urban communities, who don't know the right words, and it's not their fault. And that's why I decided to speak up. So consistently. This dog is going to bark because that dog is barking, but it's because of that. So I definitely understand what you're saying. Thank you for sharing that.
Okay, so apology, please. That's my dog. I don't know who is exciting it. I'm so sorry. Okay, yeah. So Chimere, you just like bring to light some things I have in my head. So as we were talking, I just remembered my mom. My mom, she's passed now, God bless her soul. But I just started realizing that she had so much pain from back pain. It was never diagnosed. I think now, from what I know as a physical therapist, she may have had some sort of spinal stenosis. And then there was gaslighting throughout. She gets to the hospital and I tell her, it's expected. Again, you're a woman, you've had children, you should expect to have low back pain, and you have to live with it. So nothing was actually done to address what I see now as some case of stenosis. And now, if I wasn't a physical therapist like Marcia, I wouldn't even know. Even though she's dead now, I wouldn't even know that that could have been her problem. I grew up seeing my mom. So what happened was that she became a bit withdrawn. She wasn't very active. And of course, arthritis came in and all of that, So it's like nobody really believed this was a serious issue. There were so many women, and not just so many other women that had children, had low back pain, and they were told to live with it. It's almost as if it was synonymous with being married, having children, and your children growing. So it is one of the things that we need to look at. Don't gaslight the patient. Don't let the patient think they don't know what they're saying. Whatever the patient says is important enough for the person to have dressed up and come to the clinic to say, I have this challenge. We shouldn't make it about ourselves. It should be about what the person says. When we were in school, we were taught that history taking was his story. But again, we also thought that that was like the lesser part of clinical history taking. When they have told their story, then you sit down as the expert and take your objective, measurements and all of that. Is one of the things we have to start changing. That history from the patient could have all the information that you need. And that should be as important as your objective medical outcome, skills, and all of that. So, it's just, I don't know, it's really getting emotional now. Yes, I'll stop now. Yeah.
Because it is emotional. It is. You can't be listening to this panel of amazing humans and hear the story and the complexity and the depth of what we're talking about. Because I think at the core of it, we're talking about a system, right, that is rooted in oppression. That's how the world was built, right? The myth of white supremacy. And then everything else on top of that, et cetera, et cetera, et cetera, right? Mm-hmm. And the burden is unequal among all of us, right? And is it that we're trying to achieve equity, equality, all? And again, it's back to that core, like, how do we address this? How do we solve this problem? We know we have these experiences. There are things that protect us, like education, right? But is that protective? Right?
Right.
Give us a certain level of visibility. Is that protection real?
Yes, I can relate to what everyone's just shared, particularly because I think that before the pandemic, had this kind of old school idea of interacting with healthcare professionals, which is just, I go, I tell them what's going on, and then whatever a medical professional would say to me, I just probably not pay much attention, to be honest, and then go away. And that was it. And I think that firstly, it became clear that because I've been university educated, like to be able to, as I was saying before, I guess have the confidence to sort of pick up on things and push back a bit, which I think at first made me quite anxious doing so. But I think having that confidence, I felt like, okay, I can see if I didn't have that background, my investigations would have stopped there. Because, for example, there had been an example where I most of the time had, at the beginning of the pandemic, gone in by myself to a hospital, which going into A&E as like a single black woman is pretty, it was quite scary at times, because the part of London I was in, it's quite hectic, part of the city. But ironically, the worst time I had was when I had a friend, a male chaperone, because the specialist looked at him and told all of my was talking to him about me, and my friend said, "You should know I'm leaving the room right now because you're talking to the wrong person." And then I think I have realized, I suppose, just from being in certain circles, I don't know, whether it's just how I've had the privilege of just knowing to ask that I could have a female medical professional, and how that's made quite a lot of difference, sadly, in terms of just have been treated. Just to go back to the question about identity, I mean, I had no preference whatsoever before, but unfortunately, it's just something that I picked up from going in and out of doctors, that there was a difference in the quality. Not all the time. I've had some fantastic male doctors, or people, I should say. But before to waffle on, I'd say another thing is just about mental health. Having to, I think, just overcome my own probably cultural conservatism around accessing, getting therapy, and how that has had quite a big difference with my processing what's happened. And so I'll probably stop there for now.
Yeah. So I'm so sorry to tell you all this, but we have about 4 minutes left. And so what we can do is we can finish this with the continuing question that I asked, or we could go to our last question. How are you all feeling? Because I don't want to mess with the flow. So juicy.
I'd like to answer this question. I'll try to answer it really briefly.
Yeah, wonderful. Let's do it. Perfect.
And while it's quiet, because my gardeners are here and it was noisy, so it's quiet. Anyway, so being completely transparent, I naively believed or felt that I was immune to medical gaslighting because I am a nurse. I felt like, hey, I'm one of them. Like, they're going to see me as that. But in my experience, I realized that my color and my sex trumped my degree. Like, I have experienced medical gaslighting. I have experienced not being believed. I have experienced structural racism in the healthcare system. And but that doesn't stop me from advocating for myself, and also being as loud of a voice as I can on social media, so that I can help encourage other Black and brown people to advocate for themselves, even when doctors don't believe you, even when doctors gaslight you. Don't gaslight yourself. That's the key. Say, make sure that what you're saying is what you feel. Don't let them gaslight you, and don't gaslight yourself. Don't start second guessing your symptoms just because a doctor doesn't validate it. So that's really just what I wanted to say. I had a really bad experience with a doctor who did not even touch me. We had a visit for less than 5 minutes. He was an infectious disease specialist. And after I left his office, he did order blood work. But when I read my note from his office, he did say that he felt that my illness was psychosomatic in nature. Again, he didn't even touch me, didn't take my blood pressure, nothing. And this is what he wrote. And so I wrote him a very professional but firm message, letting him know that was completely inappropriate. That, first of all, as a physician, you failed to even examine me. So how can you come up with a conclusion in terms of what's happening with me based on that? You're not my primary doctor. You never seen me before, ever, and you will never see me again. But fortunately, he did change his note, and he apologized. And hopefully that is a lesson for him that he will carry on, in the future with his career, because he was a younger doctor. But I hope that in the future, he'll think twice before he writes that on someone's note. So thank you, guys.
And Tracey, I want you to kind of take us home.
I guess I wanted to say a couple of things. I hope I can fit them in. One thing is I don't have an education. I was expelled from high school. I was a chef before this. And so I don't have that level of access. I don't have that and I was sort of thinking about it when you were talking, that it's sort of like, obviously being light-skinned, I'm often given the benefit of the doubt that darker-skinned women are not. And so I don't have to work quite as hard to be seen as a person, but I also don't have any kind of educational background where I can sort of fight back in a way that's going to be heard. And so, I think that that's really important. And since we're running out of time, I want to say that everybody in disability spaces, chronic illness spaces, everybody can agree. I think everybody that's listening, regardless, of who you are, can agree that racism is real and exists in the world, and that sexism is real and exists in the world. But then when I'm in disability spaces, people would like to pretend that those things stop at the doctor's door. And it doesn't make any sense. Like, that is not the place where suddenly this just disappears. And so I would like people to keep that in mind, when you're in spaces and being like, well, we all got gaslighted. I'm like, we know that you all got gaslighted. That's what happens with chronic illness. But we have an extra couple of layers on top of that, just like we do out in the rest of the world. So that's my 2 cents.
Bada boom. Darren, we need like an hour.
Me too.
Darren, you need to give us like 10 more minutes.
I mean,
right, seriously.
Okay. Have it.
Yes.
We're going to just calling you out. We're so messy.
Thank you, Darren.
Stick around.
No, but you all, thank you. I'm about to get emotional. So thank you. Thank you for being here.
Thank you.
Thank you for your voice. Thank you for, and I'm not going to thank you for your strength. I'm going to thank you for your humanity.
Thank you.
I'm going to thank you for that.
The strength in being vulnerable here.
It's great.
That takes strength.
Thank you.
On behalf of everybody in the chat who was chiming in as well, I can say this. Looks like the audience reacted very well. It was a fantastic presentation and discussion session. So thank you so much for giving that to us.
Thank you.
Thank you for listening.